In a move that sent shockwaves through the global health community, President Trump announced the United States' withdrawal from the World Health Organization in mid-January 2025. This decision, enacted through an executive order, marked a significant retreat from international cooperation on health issues. The Trump administration justified the withdrawal by citing concerns over the WHO's handling of the COVID-19 pandemic and what it perceived as funding imbalances favoring China. The decision drew immediate criticism from various sectors, including public health experts, humanitarian organizations, and many world leaders. Critics argued that the withdrawal would undermine decades of progress in global health, particularly in developing nations. The WHO, for its part, expressed deep disappointment, emphasizing the crucial role the United States had historically played in global health initiatives. The withdrawal has also raised concerns about the future of global health funding, as the United States has been a major contributor to the WHO and other health programs. The uncertainty surrounding future funding has cast a shadow over the fight against infectious diseases, particularly in regions heavily reliant on U.S. aid. The impact of this decision is likely to be felt most acutely in developing countries, where the WHO plays a critical role in strengthening health systems and combating diseases like HIV/AIDS, malaria, and tuberculosis. The withdrawal has the potential to reverse years of progress and leave millions vulnerable to preventable diseases. The U.S. withdrawal from the WHO coincided with a 90-day halt on nearly all U.S. global health funding, pending a review ordered by the Trump administration. This decision has cast a long shadow over the future of vital health programs worldwide, particularly those focused on HIV/AIDS in Africa. The President's Emergency Plan for AIDS Relief, or PEPFAR, a cornerstone of the global fight against HIV/AIDS, is now facing an uncertain future. Established in 2003, PEPFAR has been instrumental in providing antiretroviral treatment, prevention services, and care to millions of people living with HIV/AIDS in Africa. The program has been credited with saving millions of lives and significantly contributing to the decline of HIV/AIDS-related deaths. However, the recent funding halt has raised concerns about the sustainability of these achievements. The uncertainty surrounding PEPFAR's future has created anxiety among healthcare providers and patients alike. The possibility of funding cuts or a complete withdrawal of support could have devastating consequences for the millions of people who rely on the program for life-saving treatment and care. The funding halt has also raised questions about the U.S.'s commitment to global health leadership. Critics argue that withdrawing from the WHO and halting funding for essential programs sends a dangerous message to the world and undermines efforts to address global health challenges collaboratively. Zimbabwe, heavily reliant on international aid for its healthcare system, stands as a stark example of the potential fallout from the U.S.'s withdrawal from the WHO and the funding freeze. The southern African nation, grappling with a fragile economy and a high prevalence of HIV/AIDS, has been a major beneficiary of PEPFAR, receiving over $1.7 billion since 2006. This funding has been crucial in supporting Zimbabwe's efforts to combat HIV/AIDS, providing antiretroviral treatment to over 1 million people. The current uncertainty surrounding future U.S. funding has sparked serious concerns in Zimbabwe. Health officials fear that significant cuts or a complete withdrawal of U.S. support could cripple the country's HIV/AIDS programs, leading to a resurgence of the epidemic. The potential consequences for Zimbabwe's already strained healthcare system are dire. Zimbabwe's plight underscores the broader challenges facing many African nations in the wake of the U.S.'s retreat from global health engagement. The funding uncertainty has forced countries to confront the possibility of significant disruptions to their health programs, jeopardizing years of progress in the fight against HIV/AIDS and other infectious diseases. The situation in Zimbabwe serves as a stark reminder of the human cost of political decisions made far from the communities they impact. The uncertainty and anxiety felt by healthcare workers and patients in Zimbabwe are a testament to the urgent need for a renewed global commitment to health, one that prioritizes the well-being of all people, regardless of where they live. The U.S. withdrawal from the WHO and the subsequent funding freeze have created a critical juncture for global health. While the immediate impact of these decisions is yet to be fully realized, the potential consequences, particularly for developing nations heavily reliant on U.S. aid, are undeniably grave. In the face of this uncertainty, the international community must come together to reaffirm its commitment to global health cooperation. It is imperative to find ways to bridge the funding gap left by the U.S. and ensure the continuity of essential health programs, particularly those focused on HIV/AIDS, malaria, and tuberculosis. African nations in particular must explore alternative avenues for financing their health systems. This includes ramping up domestic resource mobilization, exploring innovative financing mechanisms, and strengthening partnerships with other bilateral and multilateral donors. The U.S. withdrawal from the WHO should serve as a wake-up call for the international community. Global health challenges require global solutions. It is time for a renewed commitment to multilateralism, one that prioritizes the health and well-being of all people regardless of nationality or economic status. The future of global health depends on it.